Hey, hey, Period Party listeners. I am thrilled to be here again with you this week, talking all about fertility and taking a more unconventional approach to IVF with Dr. Zaher Merhi, a triple board certified MD and the founder and medical director of Rejuvenating Fertility Center. Dr. Merhi is an active researcher with an interest in women with low ovarian reserve, that means low AMH or high FSH, PRP ovarian rejuvenation, gentle stimulation IVF, natural IVF, and IVF without injectables. His research also focuses on technologies such as ozone sauna that can improve egg quality, especially in women with endometriosis, immune disorders, and PCOS. Dr. Merhi is also experienced in treating overweight women and those who had weight loss surgery. He's a strong proponent of the LGBT community and has proudly served the Arabic and Jewish communities for over 2 decades. I hope you enjoyed this episode as much as I did recording it with Dr. Merhi, who is so sweet and absolutely hilarious and just so brilliant. As always, thank you so much for being here and thank you for listening. Hi, Dr. Merhi. Thank you so much for being on the podcast with me.
Thank you so much for having me. It's really an honor to be here.
Oh, right back at you. I'm really thrilled. I've heard so many great things about you from our mutual friend, Amy Raup, and I'm just excited to have this conversation because I feel like it's long overdue. I don't think I've actually talked extensively about IVF on the podcast. So you're my first IVF expert.
That's exciting.
Yeah, I know, right? I found the right IVF expert. That was what I was looking for. So I wanted to start with just a little bit of a breakdown of what you do, because obviously you are a doctor and you specialize in IVF, but you specialize in this special kind of process. And I feel like it would be so great to highlight that for everyone who's listening.
So as far as, first of all, I always start by saying infertility is extremely common these days, right? It used to be out of 12 couples in the United States, one will have fertility problem. Now 1 in 8, and actually some studies showed 1 in 5 women have fertility issues. Wow. So it's extremely sensitive matter, right? It's extremely sensitive for socially, financially, mentally, for everything, and also financial, at all levels, really, it adds a lot of stress. So I handle couple who, or single, or lesbian, or gay, or whoever, who wants to have a child, or who wants to preserve their fertility for the future. Mm-hmm. That's what I do in brief. However, I do things a little bit outside the box because most IVF has been in business since 46 years. But if you go to every place, it's really we're still using same protocols that involve so many injections that make patients go crazy, and hormonals and side effects and expensive. I think it's time to kind of, change things. And this is why I opened my own practice. And this is, why I really enjoy my job very much.
Okay. So we're going to get into it, exactly what you do, but maybe we, like you said, IVF is pretty common these days. And there are a lot of fertility challenges for so many people. I would really love to talk a little bit about low ovarian reserve and low AMH, because I hear about this all the time. And I feel like I have been able to help clients over the years address that to some degree, just by changing, dietary, lifestyle, all of these aspects that contribute to our overall health and ovarian function and fertility. So can we talk a little bit about that? Like, I would love for you to share what low ovarian reserve actually is for anyone who doesn't know. And maybe we can talk a little bit about how often this is happening and why you maybe think this is happening to so many women.
Sure. So women are born with a certain amount of eggs, and this is it. Unfortunately, they do not make new eggs, even though this theory has been challenged, but this is what we know so far. Unlike men produce a lot of sperm until they die, usually. That's the only good thing about being a man, I promise you. But
I like that.
Women are born with a number of eggs, and let's say this is your saving account, or checking. Let's go checking. Imagine it's an ATM machine, right? And women spends cash every single month until you run out and the ATM is empty, and this is what we call it menopause. Now you cannot put money inside this ATM machine. Now, some people, let's say you spend $100 a month, and this is what the ATM machine you have. Some people are born with more eggs or more money in the ATM machine to start with. So if they're spending $100 a month, they will have a lot of money until they're 50, 55. This is when they go to menopause. If women are born with less number of eggs, they don't have they run out at age 40 or even 35 or 28. We call it premature ovarian insufficiency. Now, ovarian reserve testing, we do tests such as AMH and FSH hormones, which tells me at this point, because let's say I didn't meet Nicole until now, right? And so let's say you come to me and say, Dr. Merhi, I want to know how much I have in my ATM machine. There is tests that I do and say, okay, this is how much you're left. This way you can plan the future on how you're going to spend this money. Now, what I tell patients, what I tell women, reserve is how much. It's not how good. Does not tell you anything about the quality. You can have an ATM machine full of money, but when you get your $100 all bad, you cannot spend it. No one's taking it from you. Or you can have very few money and, buy a house. So what I'm trying to say is that reserve is how much, not how good. That's why I have patients all the time very upset because they're told, oh, your ovarian reserve is low, you have bad egg quality. Well, that's not true. The only time you know the quality of the egg is when you take out the eggs outside the body by an egg retrieval and look under the microscope.
Right. Okay. That's so helpful to hear, because I think that oftentimes we get the message that we have low ovarian reserve or premature ovarian insufficiency, and we feel like all hope is lost. And I've actually referred a number of people to you at this point because this is something they're coming to me with, and they want to get pregnant and they just don't know what to do. I'm like, okay, well, there are options, which is so nice now. And so is this the most common reason why women seek out IVF in your practice or your experience?
Well, look, I think it depends on the practice, right? Excuse me. Some centers don't want to take women with ovarian reserve. So really, when you look at their numbers, only 10% of the women have low ovarian reserve because they care about their pregnancy rates. They don't want to take someone who has low number of eggs. I don't care. Everyone knows that. I'm treating people, not numbers. But if you look at the fertility centers overall, around 20 to 25% of women are women who want to do egg freezing, right? So these are not women who have infertility, who's never tried with a man before. Then you have a small percentage, which is lesbian couple, trying to get pregnant, a gay couple, and all that stuff. Then you have, let's say, 70% now of the other remaining patients. I would say 1/3 low ovarian reserve, 1/3 male problem, and 1/3 other things such as endometriosis and PCOS. Right. So it is a big chunk. Why? Because, it's hard to know why, but I don't think women are waiting longer, but also there's more awareness about infertility. I genuinely contributed to many other environmental factors that we can talk about later if you like. But this is as far as percentages. Yeah.
Okay. Yeah, because I've been thinking about this a lot with sperm health. I know you mentioned, obviously, men, they make a lot of sperm over time. But, I feel like I've seen this in my work where women are undergoing IVF not because they have an issue going on, but because their husband might have, or partner may have, low sperm count, or the sperm morphology is not quite, I think I got that terminology right. It's not quite healthy enough. And so I feel like in many instances, and maybe I'm wrong, but it's that IVF is being used for a male fertility issue. Have you come across that?
Well, first of all, it's always the man's fault in my book. So my patients, I don't care what they say. It's even if the sperm is perfect, it's the man's fault. So
you're so smart. I love it.
Look, the reality is, believe it or not, in the last decade, some countries had 400% increase, Nicole, 400% increase in male infertility.
Wow.
Why? Environmental factors, plastic, BPA, toxins, radiations, cell phone radiations that nobody talks about, hand sanitizers that nobody talks about. All those have chemicals and toxins that have been shown to be bad for the sperm and the egg.
Right.
Bad for business, so nobody talks about them. But I can tell you, this is a major reason as to why we're seeing this jump. Frozen food, the stuff that they put in the food, to preserve it. So many things. So
Right.
many cleaning stuff in the house. Look at them. Most of them don't have the full. They're not transparent about the ingredients. In my opinion, you don't know what they have.
Yeah.
You clean the house, you're inhaling all that. So there's so many things, Nicole, we don't know, or they're not really focused on. Let's put it this way. That, in my opinion, and in other experts' opinion, does contribute significantly to the male infertility. So that's why I recommend every man at some point to check also the sperm, because if they're low, freeze them before you run out, because men can go into andropause as well, which is similar to menopause. You can run out.
Yeah. Yeah. No, I think that's such an important conversation to have, because I really do, I do really appreciate your perspective and the way you treat people in your practice, because I just keep hearing about this and I just keep thinking, well, sperm is so impacted, just like our eggs are, by environmental factors. And so shouldn't we be working on the personal environment before going down this route? And so I'm glad that you talked about all of those things. And I know that you're quite non-conventional in the way that you do things, and your big focus is on egg quality and not on egg quantity. Can we talk a little bit about that, the difference, and why you're focusing on that instead?
So I'm going to start by telling you, I had a patient last week who sat in my office in Manhattan, and I said, how many IVF cycles you've done? She said 5. She's young. I can't remember the exact age. Every cycle she was getting between 30 and 40 eggs. When we counted the eggs, it was 160 eggs.
Wow.
Over 5 IVF cycles. And she has 0 babies.
Oh.
So I don't care. No, I don't.
Right.
You know what? If you want to have a football team, yes, you might care about the number. But if you want to have a couple of children, you really need to focus on the quality. Because number one, I always tell whoever's saying, oh, why you're not giving, first IVF baby in the world was natural cycle. The patient took 0 medication, nada. So, and then we started to give pills, then we started to give shots. Now everybody gives 2, 3 shots. It's time to kind of slow down and say, okay, what are we doing here?
Mm-hmm.
I have patients who have low ovarian reserve, especially women with low ovarian reserve and above 40. They pump them with drugs, they develop 1 follicle. And then they cancel the cycle. I say, you know what, Mrs. S.A. Brown, for example, if you took no medication, what would have happened? She said, I would have developed 1 follicle. I said, so this medication did nothing.
Yeah.
The most expensive follicle, you spent $5,000 of medication to develop 1 follicle. You could have done it on your own. She said, that's true. So and also a lot of studies showing that too much shots actually are bad for the quality of the eggs, especially in women with low ovarian reserve and women above 40. Having said that, focusing on giving the ovaries what they want is the key. The follicles are like human. Someone who has a lot of eggs and a lot of follicles, they need a lot of food. The medication is food for those people, for these follicles. You have less eggs in your ovaries, less people, give them less food. When you and your partner, whoever you live with, let's say you're 3 people in the house, every one of you is an egg. I cook for 3 people, give you the food, you'll be happy. If I cook for 10 people and shove it in your mouth, you're gonna vomit. Don't overfeed the eggs, because they, believe it or not, they actually shut down their mouth, which is the receptor, and they die instead of growing. And to support what I'm telling you, a lot of those patients, they start with 8 follicles. At the end of the stimulation, they have 1 or 2. Why? The other one actually died on the medication.
Wow, that is fascinating.
So it's not more is better. I individualize the treatment based on every patient's response. Nicole and her twin sister are not the same body. Even Nicole, if she does 2 cycles with me, I don't give the same protocol. Why? Even if the first one worked. I have patients all the time. Oh, Dr. Merhi, why are you giving me a different protocol? It worked last month and we got a couple of embryos. I say, because last month you had 10 follicles and your FSH was 5. This month you have 5 follicles and your FSH is 15. How can I give you the same protocol? It's not going to work the same. So changing, looking at what the body wants and give the body what it needs is what my strength is.
So perfect. I mean, it's right up my alley. And I think that this idea of personalized IVF procedures makes so much sense. Like exactly what you said about, different months, things look different. We're under certain stresses some months versus others where we're not. So it makes a lot of sense. And so with your process, do you have higher outcomes than sort of like a typical IVF approach? Like what happens to most people?
Tell you, with low ovarian reserve, no offense to any other centers, I have one of the best outcomes. I have patients, look, 40% of my patients were told, you'll never get pregnant with your own eggs. You need to give up. It's not going to happen. It's impossible. Go to donor eggs. And out of those, half of them have babies with us. Literally.
That's incredible.
But let me tell you why. There is so many reasons why doctors, they push to donor egg, because it's better pregnancy rates. And we have to report our numbers to the CDC and some other thing that they use it as a marketing tool, which is fine. I'm not bad-mouthing anybody. They're all my colleagues. I love them. That's okay. Some places, they have protocols they can't break. This is what their CEO says. This is what their medical director. As much as they love to do something different, they can't. There's a lot of centers and universities, and I'm a faculty also at the university, SUNY Downstate, but some universities don't allow you to do anything outside the box. It has to be under a research program or IRB approved and committee. It makes it harder for them. So there are some insurances who doesn't allow you to cover IVF. They don't let patients if the ovarian reserve is low. So what I'm trying to say is, this is my specialty. Okay, I've been doing this for a long, long time. I have had patients who have undetectable, zero AMH, who had babies. So to me, if you give me someone with good number of eggs, I can get them pregnant in my dream. I don't like easy cases, okay? I don't. I'm sorry. I don't.
Well, I admire that about you, doing the hard work for us. So
but that's what makes me happy. I'm being honest. Sorry, I don't mean to interrupt. Look, what makes me happy is not how much money I take with me to the bank, and everybody knows that. My patients know that. My staff knows that. Everybody knows that. My goal is to change the field forward, because I want to die. I say Dr. Merhi was to change the field of fertility. Not the richest REI doctor. I don't give a shit. Excuse my language, but that's the truth. So if anybody difficult, send them my way, because to me, I like to try new things. We need to push the field forward and not give up and jump to donor egg. I'm not against donor eggs, Nicole, by any means, but we shouldn't quit immediately. There are a lot of things in the science published every day that we're not even considering. So why we do research and spend money? There's tons of studies showing diet and nutrition plays a role, including and they tell them, oh, diet does not affect egg quality. BS, it does. So sorry, I get too emotional sometimes.
I do too. I get very fired up. I mean, I feel the same as you. The fact that we're even saying that diet doesn't affect things like this still is crazy to me.
Right. And those people there are people who have published on diet. So look, that's why, there is conventional way of doing things and there is non-conventional way of doing things. There is a lot of people these days, and I applaud them, including myself. I don't like to take chemicals if it's not needed. Why do I need to put myself with things and put chemicals on my body? Yes, they're safe. They don't cause cancer. This is what the SRM said, but I don't know what's going to happen on long term for us. So less is better, in my opinion. Go organic. Organic is better than non-organic.
Yeah, I really want to get into this, because I know that your motto is kind of like making IVF easy. And you mentioned, the less chemicals and all of that. So can we talk a little bit about your approach? Because I've heard all about the ovarian PRP, aka ovarian rejuvenation, and I would love for you to share about that, because like I said, I have people coming to me and they're like, I've tried everything and I don't know what to do. And I feel like this is a really promising solution for lots of those people.
Yeah. So look, the PRP, or platelet-rich plasma ovarian rejuvenation, is basically we're taking your own blood, we're getting one layer out of this blood that has the plasma and platelets, and then we're injecting it inside your ovaries, because your ovaries, even though they have blood flow, they don't get this layer as much as they need it. And PRP has been used for decades for things other than fertility. It's used for hair loss, for joint injuries, for teeth, facial rejuvenation, so many things, right? Now, the Greek people, and I was laughing at them 10 years ago, I thought they were crazy. We're starting to put it in the ovaries. I'm like, what the heck? Patient was like, Dr. Merhi, I want to do PRP in my ovaries. I'm like, what does it even mean? Go to Greece. I don't believe in this. Look, I'm a very evidence-based guy. I need to believe in medicine. You need to publish to show me it works before I use it. Right. Otherwise, I'll be what? Scamming people and taking them. It doesn't work like this. So then the Greek people and others showed tons of data in end of 2018, early 2019, compelling data, great journals showing that PRP, when you put, they took ovarian follicles from women who are undergoing hysterectomy and they put it in PRP, and they showed how the follicles are happier when you put them in PRP. They put mice in menopause and they put PRP in their ovaries, and they show how the follicles develop after. So, and then humans, this is when I started to do PRP. Now, the PRP, or platelet-rich plasma, can improve quantity or quality of the eggs, or both. But I always tell patients, it might not work for you either. With my experience, 50% of women who do PRP do extremely well as far as egg. It's not pregnancy. It's the pregnancy is the other different than the egg. Once you talk about pregnancy, you're talking about the uterus and the sperm. And guess what? They play an important role. It's not always the egg and the woman's fault. The sperm plays 50% of the story.
Exactly.
Someone has bad fibroids, many C-section. So I'm not saying PRP has 50% chance of pregnancy. So I want to just make it clearer, because some people misunderstood me in the past. It improves the quantity / quality of your eggs, or both. To make a baby, that's a totally different chapter.
Right. And so you mentioned something about mice in menopause just now, and doing PRP on them, and what happens with their follicles? Do they start to become viable again? Like, what happens there?
Yes, they actually develop new follicles and become viable. Now, remember when I started and I told you the ATM machine and people are born with number of eggs, even though this area has been challenged?
That was what I was about to ask.
So it is challenged. We have stem cells all over our body. Stem cells are virgin cells that doesn't have a function. They're in the scalp of the head, they're in the ovaries, they're everywhere. They're in the fat. Look at my belly. It's fat belly because the stem cells divide and they can grow and become fat cells. It's true. Fat has plenty of. The bone marrow have a lot of stem cells. Now, when you put PRP in the hair scalp, the PRP activates those stem cells to become mature and have a function. And if the stem cell is in the scalp, it becomes a hair follicle because it gets a job based on where it belongs. If I am a stem cell in the army, you wake me up, activate me with PRP, I become a soldier. If hospital, I become a nurse or that. Same thing. Ovaries have ovarian stem cells. You put PRP, they activate those stem cells to become new, younger eggs. And that's why PRP has been shown to put people who have menopause to start menstruating for a few months, and women with premature ovarian failure to also develop eggs, and their AMH goes up. So go and look at the studies. Happy to share them with you, but that's how it works.
That's incredible. I mean, I feel like that's revolutionary when you consider the fact that, like I said, I've just had many conversations over the years with women, and they've just said things like, well, I've been told there's no hope for me. I don't know. There's nothing I can do because I have premature ovarian failure or primary ovarian insufficiency, and that's it.
Well, I can tell you, first of all, if you go on Google and put, what are the chances of me getting pregnant with premature ovarian insufficiency? Naturally, listen to this carefully. Without anything, it's 5 to 10%.
Oh my
so,
God. Yeah.
The reason why premature ovarian insufficiency women get pregnant 5 to 10% of the time, because by definition, they're younger than 40, so they have good quality eggs. The younger person, the better quality, because quality of egg correlates with the age. Now, every now and then they pop an egg, and if they're having sex at the right time, they can get pregnant. So if someone has POI and they told you can't get pregnant, it's wrong. It's written in every single book I've read.
Yeah.
Now, PRP, I always tell patients, can double your chances of getting pregnant, maybe from 5 to 10% up to 10 to 20%. Now, premature ovarian insufficiency is complicated. There are reasons that we know of, reasons such as genetics, and some unknown reasons. So it might work for different groups differently. So that's why I tell patients, I don't know if it's going to work for you until you try it.
Yeah.
Okay. And like everything else, I don't know what happened to me if I take a pill, a new pill that's being investigated, or COVID. Okay. If I don't know what's happened until I get COVID, some people die, some people don't even know they had COVID. Why? We don't know. There's a lot of genetics, a lot of many other factors. They play a role in every disease and every medication and treatments.
So can you talk a little bit more about the other things that you do? Because I know it's not just PRP, I believe. You do
Ozone sauna.
Ozone saunas. Yes, that's what it was. Yeah. And you talk about your like gentle stimulation IVF and natural IVF. And I think that's just so fascinating because again, like I don't really know these terms because IVF is not my forte at all. But I think that it could be so helpful for anyone who's listening to hear about like the ozone saunas and how that all works.
Yeah. So look, as far as the ozone sauna, I've actually heard about ozone from one of my patients. I didn't know what ozone is. Okay.
Yeah.
Until maybe 4 years ago or something like that. I did literature search. Of course, I like to read medical articles. I found tons of studies on animals, tons.
Yeah.
Tons, like hundreds. I'm like, how come this hasn't been studied in humans? So I brought the machine, did a study, found that it improves significantly the egg quality because same patients do 2 IVF cycles, one before ozone, one after ozone. They got same number of eggs, but their eggs after ozone, they made much higher number of embryos compared to before ozone. So now ozone is oxygen times 3. The oxygen that we inhale is O2. This is O3. So there's an extra oxygen, a powerful oxygen. And it's a very powerful anti-inflammatory agent. It's a very good antiseptic. If you want to clean anything, get ozone water. It kills everything. It used to be used in World War I to sterilize instruments because they didn't have all these machines that now sterilize. So we have inflammation. Most of us have inflammation. Let's be honest. If someone tells you I don't have inflammation, you're not living on Earth.
Yeah. So true.
So, between being overweight, between PCOS, between endometriosis, between thyroid, between autoimmune disorders, rheumatoid arthritis, celiac disease, all that is inflammation. An aging process, forget about everything. Aging by itself is an inflammatory process. There's a lot of oxidation in the tissue. And ozone is one of the most powerful antioxidant and anti-inflammatory agent in the world. One of the most natural ones, right? It's not a medication. Now, it's a very comfortable machine. We have it here in Westport. We have it in Westchester, and we have one in Long Island. You sit in the machine half an hour, you put it naked, and then it goes through the skin to the body. And also there's a hose, disposable, of course, put it vaginally, patient put it yourself, like very tiny, blows ozone in the vagina that goes to the ovary and the uterus to lower inflammation and increase the antioxidant effect. This is done like acupuncture, twice a week for 3 weeks. You need at least 4 sessions before you see any benefit. Mm-hmm. And let me tell you, it works like magic. Right now, we published that it works for women with low ovarian reserve and poor egg quality. Right now, we're actually doing a study free. You don't have to pay. If you have endometriosis with a lot of pain, you qualify for free 6 sessions of ozone. If you have PCOS and irregular periods, you qualify. If you are a man with poor sperm, you qualify. So take advantage of it, because if it works, then we're going to have to charge you.
Dr. Merhi, you're so funny. That is fascinating. Of course. Yeah, of course. You've got to charge for what you do.
But listen, not because I have to pay my people and my rent. We have to pay the bills. I love research, but we have to like balance it. There's a medical department hates me. We're always fighting because I like to do free things, and they're like, "This is a business," so I'm always in fight with them. I beg them for discounts and stuff, but now it's like really I'm in trouble. But anyway, back to you.
You're so funny. I love it. No, that is really cool. I'm like, I want to try this ozone thing. This is so neat. I'm just so fascinated. I need to come and get a free ozone.
I promise. I promise. I won't. Amy loves ozone. She did it for men a couple of times. You can talk to her about it. She had great experience with it.
I'm totally going to have a chat with her about it. I think this is so cool. And so before we wrap up, can you just talk a little bit about what gentle stimulation IVF is and natural IVF? What is all of that? And I know that's what you're doing, but I think it's so helpful to just kind of understand the difference between that and sort of the traditional approach.
Sure. So IVF with us at RFC is a spectrum from zero medications to conventional, which is tons of shots. In between them, there is IVF with pills, which is enough food if you have up to 5 follicles. Then you have, this is called gentle IVF. Then you have pills plus a little bit of dose of shots, also gentle/mini IVF. Then too much shots, conventional way. We do all of them. Let's go back to my thing. Medication is food. The more follicles, the more food we give them. But some people don't want to put any chemicals, even though they have a lot of follicles and they can get 20 eggs. They just want to do natural and they get 1 egg at a time. So the difference between natural is zero medications, gentle is pills alone or pills plus shots, and the heavy or conventional is too much shots. Now, we have a patent for home IVF kit, which has 0 shots. It's pills by mouth, vagina, and nasal spray. We made it to your house. You don't have to take any shots, 0 shots. And then you come only for the egg retrieval because you don't even monitor to do blood and ultrasound and stick yourself and all that. And then you come only for the egg retrieval. This way you're stimulating yourself with pills. There is no chance of having ovarian hyperstimulation syndrome, which happens a lot with conventional way. And you just show up to our office, say, I'm here for my retrieval. I already took the pills. And the kit tells you day by day what to take in your menstrual cycle. Day 3, you take a packet. Day 3, take those, swallow them. Day 4, the next day. Now nasal spray. That's it, 0. So that's called needle-free IVF also. Patients who are afraid of shots, which I'm one of them, scared of them, hate them. Some people have phobia from needles, Nicole.
Oh, no, I have friends who are terrified of them. Totally, I get it. Yeah.
So if you can get the same outcome without shots, why not?
Totally.
So we do that. So any type of IVF you think of, we do.
Okay.
Now, what new we got licensed from the Department of Health is actually portable IVF. Wherever you are, okay, wherever you are. Put you in any office. There is no IVF lab. We'll do retrieval for you. We take the eggs, put the sperm, portable incubator, ship them to Manhattan or Connecticut where we have a lab, fertilize them, make embryos, ship the embryo back to where you are and put it inside your uterus. You don't have to come to any of IVF lab or surgical room. This we launched 2 weeks ago. I got approval from the Department of Health. It's not easy process, I can tell you that, because when I applied for the Department of Health, they didn't even know which forms they need to give me because it's never been done before. They said, Dr. Merhi, we have to meet because we don't know what forms you need to fill. So that's something we do because some patients don't want to go to Manhattan or big cities. You know, they want to be in rural areas, they're exposed, or they have disability, or they're in the Hamptons, they don't want to come to the city, it's too far with the traffic. It's true, and
right.
We do instead of you coming to us. And we've had a lot of pregnancies, and we're offering this right now.
That is fascinating. I had no idea. I feel like I just got a crash course on IVF.
Wait, listen, it's like the Amazon or Uber of IVF. We come to you. You don't have to come to us. That's my goal in life. Okay, that's what I want to do.
Clearly, you're making it so easy and so accessible. And I think that that's the best thing too. And anyone who doesn't know, you guys should definitely check out Dr. Merhi's Instagram page, because I feel like you do really cute, funny reels where you guys dance and do things together, you and your staff. So you make it very accessible.
I keep gaining weight. So for my dances, my belly's shaking now. I have to
That's okay. You're doing good in the world. Well, I would love for you to just tell everyone who's listening where they can find you, your work, how they can get their hands on portable IVF, those things.
Sure. So our website is Rejuvenating Fertility Center. There are buttons, so it says contact us. You can enter your information. We reply to you in less than 24 hours. You can contact me through my Instagram, DM me. My account is Dr.Merhi, Merhi. And our office one is Rejuvenating Fertility Center, Instagram. You can DM us anywhere. Feel free also to call us, 203-559-7979. Wait, I don't call my office number. Wait, hold on. 203-557-9696. It's like you don't call your office, right? How are you supposed to know?
I was so impressed that you spouted off a phone number to begin with. So yes.
At least I thought that I was wrong, because I'm like that. So this is how you can find me, and I'm more than happy. You can send them to me through you. I'm more than happy to help with anybody have any questions and stuff like that.
Okay. Thank you so much again. I so appreciate your time and your brilliance and your pioneering spirit. I'm so glad that there are people like you doing this work.
It's an honor for me to be on your podcast, and thank you so much for having me. It was a lot of fun.
Thank you. That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest Period Party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at NicoleJardim.com/quiz.